My name is Erin Harris, and this is a presentation on the use of situational exposure therapy and lorazepam in the treatment of social anxiety in adolescents. So let's break that down. Adolescents are children who range from 13 to 18 years old, and they would specifically be dealing with the mental disorder of social anxiety. Social anxiety is a mental disorder where the patient truly believes that something negative or bad will happen to them in social gatherings, and it becomes a phobia or a fear. Exposure therapy and lorazepam will be the treatment used in treating these adolescents to cure them of their social anxiety. First, let's talk about exposure therapy. Exposure therapy is a cognitive behavioral therapy used to treat many different mental disorders. In this specific case, we would be using gradual situational exposure therapy. There are 3 different types of exposure therapy, however, those are not important to this specific presentation. Situational exposure therapy will be gradually introduced to the patient with the idea of helping them to become more confident in social settings. The treatment will have to be continued for many months or years depending on the severity of their social phobia. Each patient will have a different journey and a different outcome due to many different factors. We will get into that later in the presentation. Exposure therapy is the best method, in my opinion, because it will teach the patient over time that nothing will happen to them in a social setting. Gradual exposure therapy is quite literally what it sounds like. They will gradually expose this patient to their phobia, in this case, social anxiety, and the idea there is that the patient will feel more comfortable knowing that they will be okay. Lorazepam is a medication selected to help aid the patient in their recovery of social anxiety. Lorazepam is often used in patients with anxiety to help counteract their biological factors that go on in the body when anxiety strikes. So when a patient comes into interaction with their phobia, the body will tell them that they are in danger, releasing chemicals in the body that make them increase their heart rate, have heart palpitations, and different things like that. The lorazepam will help to calm down the body and make it realize that they're not actually in danger, therefore not making them as anxious in situations where they have nothing to fear. Situational exposure therapy and lorazepam will come together to create the best treatment option for these adolescents, as long as it's carried out for the time allotted. 60 million people in Europe alone suffer from an anxiety disorder. This is credited from Perkins' article written in 2013. So what does this mean? It means that anxiety disorders are more prevalent than talked about. Many children are suffering from social anxiety. Some can't speak out about it, some can't get help, and some don't truly understand what's going on. Exposure therapy and lorazepam are the first steps in confronting their disorder and allowing them to get on the right path to overcome their phobia.
Through the eyes of someone with social anxiety disorder, also known as SAD. I hear the kids in school talking about their weekend. I hope no one talks to me because I don't want to say anything dumb. I don't want to give them a reason to judge me. They don't realize how much I wish I could be like them, to have confidence, to not worry about what others think about me. During lunchtime, I often go to the library to write in my journal to help calm my anxiety. I write about my thoughts, feelings, and really anything that comes into mind at that moment. Today, I'm going to write about when it all began, when I was diagnosed with SAD. When I moved to a different city for university, I knew no one. I started noticing that I was constantly nervous around others. I was in constant fear of being judged. I was being very self-critical, and I thought I wasn't good enough, smart enough, or funny enough. Being in social situations made my heart rate increase, it made me nauseous, and it made me sweat and even shake. Sometimes I became so scared that I felt like I was suffocating. I went to see my doctor after I recognized my irrational behaviors. He reviewed a list of situations to see if they make me feel anxious, and I was required to complete a self-report questionnaire about my symptoms. After several doctor visits and countless hours discussing my symptoms, I was diagnosed with SAD. My doctor explained to me that the causes for SAD can be environmental, which include meeting new people, being exposed to physical and emotional abuse, bullying, and even family conflicts. He also explained to me the genetic components associated with SAD. I do have a family history of anxiety disorders. He explained to me having a family member with SAD means that you are 2 to 6 times more likely to being diagnosed. Also, he told me about recent research that has shown that changes in a gene called SLGA4 is associated with SAD. SLGA4 is involved with the transport of neurotransmitter serotonin, which helps to soothe nerves and stabilize moods. However, it is important to note that both a shortage and excess amounts of serotonin have been linked to SAD. Today in class, we'll be learning about social anxiety disorder, SAD, which is something that I already know a lot about.
What are the brain mechanisms and possible treatment options for social anxiety disorder?
Oh no, he's asking me a question. Social anxiety disorder is caused by hyperactivity in the area of the brain called the amygdala. The amygdala controls the body's fight and flight response to respond to perceived threats. When the amygdala is stimulated, it triggers anxiety symptoms. When individuals experience a lot of anxiety, the frontal part of their brain, known as the prefrontal cortex, is able to assess the perceived threatening situation rationally and calm the anxious reactions by sending signals to the amygdala. But people who have SAD have a prefrontal cortex that increases the activity of the amygdala instead, which leads to excessive anxious feelings. They have a fear of other people's reactions that their brains interpret social interactions as legitimate threats, and no amount of rational reflection can completely soothe their fears. There are many treatment options currently available to those with SAD. They include anti-anxiety medication, cognitive behavior therapy, and acceptance and commitment therapy. Therapy is considered to be one of the most effective treatment options as it focuses on identifying individuals' thought patterns and helping them to develop skills to deal with their troubling thoughts. Many of my loved ones have been asking me how they can help me with my social anxiety disorder. So today I decided to do some research. Here is what I found. If you have a friend who is struggling with SAD and you're wondering how you can help them, here are some things to consider. Try to be patient, avoid criticism, be a good listener, encourage them not to avoid social situations, and educate yourself about the disorder. If you have a child who has SAD, show them affection. Avoid criticism and being over-controlling. Avoid stepping into social situations to make your child feel more comfortable because they have to learn how to cope with these situations by themselves.
Exposure therapy, also known as situational exposure therapy, is simply just gradually introducing the patient to their phobia with the expectations to slowly begin to desensitize the patient to their phobia. This will be done in a gradual manner due to the fact that these are adolescents. 13 to 18-year-old children will struggle more with this type of therapy because they are so young. However, when done correctly, exposure therapy will begin to slowly desensitize them and allow for their brain to realize that they are not in danger. when in a social setting. Situational exposure therapy will eventually become more comfortable and less likely to introduce the anxieties of the phobias. There are 3 different types of exposure therapies. However, we will be using in vivo exposure therapy, also known as exposure therapy. And this is basically just exposing the child to a social setting so that they can become more comfortable around what causes them fear. The key to overcoming fear is persistence, and the only way to attack that is through exposure therapy. The therapist will be there to monitor the child's behavior, and if things start to become overwhelming for the child, it can simply be stopped. In fact, if exposure therapy is done too fast or too much, it can overwhelm the child, which will make them more scared of social anxiety. It is a careful balance, but when done correctly by a licensed therapist, it has the ability to be the best form of cognitive behavioral therapy to cure their social anxiety. There is no cure to social phobia or social anxiety. However, it can be lessened to the point where they don't feel anxiety when they're in a large group. This is in fact the goal of exposure therapy, to desensitize the patient to their phobia. To be effective, however, cognitive therapy requires a large number of sessions, cited by Creswell in his article from 2017. The therapy will have to be maintained and bought into by the patient in order for the success to be surmountable to the point of no phobia. This is one of the downfalls of the therapy because young adolescents often don't buy into the therapy. They don't appreciate what the therapist is trying to do for them. All they know is that this is scary and they're having to do things that they don't want to do. This can be helped, however, by the parents and the therapist. With the right support system, the students will be able to understand what is going on and that they're just trying to be helped. This is the first step. If you can get the adolescent to buy into the therapy, the success rate of the therapy will rise. An example of exposure therapy used for adolescents would be to take them to a park or an ice cream parlor where young children can often be found. You would not want to force the child to interact right away because this would not be gradual. That would be flooding, and that is not the focus. We want to gradually introduce the adolescent to the idea of talking to the children with the goal of eventually them being able to talk to the child without having anxiety. Gradual therapy is best used with young children so that they don't become overwhelmed. An example would be first having them go to the park, but not being forced to interact. Then eventually having them walk through the park, but not having to interact. Then we can move up to having them interact with one child, and then maybe you leave or allow them to go back on their own. The end goal of this would be for them to gradually be able to have conversations and interact with other young children without having anxiety. That would be an example of cognitive behavioral therapy that we would put the child into for them to become successful in their exposure therapy.
One week before she begins her treatment, I meet Siddhartha outside the clinic in downtown Boston. With her therapist nearby, we do a brief field test to assess her level of anxiety in situations that have been difficult for her in the past. For starters, I suggest we try to take a subway to a local mall. She says she'll try.
When was the last time you were down in a subway like this?
Oh, about 2 years.
Do you feel like you could go through the stalls or not? You just tell me. I mean, I don't want to push you. You just tell me you don't want to do that. Why? What are you feeling?
Because because then I feel like the pressure that once I get past the stalls, I've kind of paid for the token and I kind of can't go back. You know, again, it's like that first step that, you know, you're always trying to think of a way out.
You want to get out of here?
Yeah, I do. I want to.
A week after we tried to take the subway together, Siddhartha returns to the Center for Anxiety Disorders to begin her therapy. The first 3 sessions focus on panic control treatment to help Siddhartha understand the nature of anxiety and how to deal with the fearful thoughts she often gets during a panic attack.
In some ways, it takes a leap of faith. The patient is so very fearful, and you're having them confront their worst fears.
In some respects, what you're really trying to do here is you're bringing her right to the brink of feeling panic. What if she has a meltdown? What if she has a panic attack right there?
Well, she will likely have a panic attack. But will that mean a meltdown? I don't think so.
Finally, a sort of panic attack chaser. Siddhartha is asked to drink an entire bottle of caffeinated water to actually heighten her anxiety so she can more fully experience the exposure therapy.
We're going to start today. Where do you think we're going to start?
In the elevator.
Yeah. How do you feel about that? What's your anxiety from 0 to 10?
Like 10.
For Siddhartha, like some other agoraphobics, elevators feel like vertical tombs. She hasn't used one in years.
Ready?
She'll take the stairs or nothing at all.
You can do it.
But not today.
Okay. It's okay. Just step in.
As it turns out, getting in is the easy part.
What's your worst fear?
That we'll get stabbed
And then what?
and we'll die in here.
Okay.
The therapist is steady and reassuring, but it's still 15 minutes before Siddhartha can even attempt to close the door.
I'm thinking, like, I don't even know if I can do this.
Why can't you? What's holding you back?
I'm afraid. I'm so scared.
It's your fear. This is hard.
Under therapist Sandra Baker's guidance, Siddhartha experiences a full-fledged panic attack.
And I have all these anxious thoughts about what will I do when the door closes.
For Siddhartha, simply being able to ride this elevator will become an act of terror and ultimately liberation.
I'm going to take my hand off of the button, and I want you to feel the anxiety. It will not hurt you. I'm taking my finger off. You're okay. You're okay. You're okay. That's just a behavior. That's anxiety. Feel it. You are fine. Look at how fine.
Wait, which one? Oh my God.
Just let it come out.
Oh my God. Okay, I'm gonna let go of you, Sandra.
Finally, Siddhartha breaks through her worst fear.
You're doing it. This is great. You're doing it.
Oh my God.
Okay. Now don't go out of the elevator yet. I want
Okay.
you to just stay.
Eventually, like removing the training wheels, Siddhartha has to do it on her own.
Ready? Okay. You can do this. Oh, this is hard. She's going down.
Repeating the experience again and again breaks the back of her fear, and with each successive trip, Siddhartha's anxiety decreases.
Exactly.
Having taken her first leap of faith and found herself still mentally on solid ground, the next step was slightly easier. Back to the subway, again with therapist in tow. This time, although she was a bit nervous, she was able to take the train with the therapist. Then, once again, she had to do it on her own. Over the next 3 days, Siddhartha would not only ride the subway all over town, but also gain enough confidence to ride a bus by herself for the first time in years, to drive a car again, and to enjoy the simple pleasures of strolling the streets to do a little window shopping.
How are you doing?
By the time I caught up with her at the Prudential Center in downtown Boston, Siddhartha seemed like a very different person from the young woman I'd met just a couple of weeks earlier.
Lorazepam is a medication specifically used in treating anxiety, in this case, social anxiety. Because anxiety has physical effects on the body, like high blood pressure or heart complications, it is imperative that the health of the child comes first. When exposing the child to something that causes them anxiety, you do not want them to become overwhelmed to the point where their health becomes in jeopardy. This is why the addition of lorazepam to the situational therapy is imperative. Lorazepam increases the chemicals in the brain that calm the nervous system. More specifically, it enhances the body's level of GABA, also known as gamma-aminobutyric acid. That information was cited from Perkins' article in 2013. He also wrote in the same article exactly what happens in the body when a phobia is encountered. Understanding what happens in the body when a phobia is encountered is important because then you understand why lorazepam is a key factor in the treatment of adolescents with social anxiety. When a child comes face to face with a phobia, they will trigger a fight or flight response. This is the brain sending a signal through the amygdala that they are in danger. However, this is where the disorder comes into play because the child is not in danger. They are mentally scared of a social setting. This is exactly the thought process that we want to reverse with therapy. When a social setting is encountered from a patient who has SAD, otherwise known as social anxiety disorder, the first instincts are for the forebrain to dominate the body and alert the body that they are in danger. This will send neural streams and awake the brain. The lorazepam will come into the brain and increase the GABA, which will calm those neural streams and allow the brain to understand that the danger is not a high risk, it is a mild risk or a low risk. And with more therapy and more exposure, the low risk will become no risk. The combination of situational exposure therapy and the medication lorazepam have the potential to be a very effective combination in the treatment of social anxiety in adolescents. This is because of the way that they complement each other in the side effects of the phobias. For example, when a child encounters something that spikes their heart rate, the lorazepam will calm them down and allow for their brain to have time to realize that the danger in the situation is not as high as first thought. The exposure therapy will allow for the child to feel more comfortable in situations that used to cause them high amounts of anxiety. Along with desensitizing them to their phobias, therapy will also have taught them many coping mechanisms and allow them to have resources to lean back on and rely on when they feel they are becoming overwhelmed in a social setting. Exposure therapy and lorazepam will have long-lasting effects on the patients who put in the most work. By this, I mean that cognitive behavioral therapy, no matter the therapist, no matter the length of time, will not be successful unless maintained by the patient. The lorazepam is a medication that will be taken daily by the patient and allow for their body to have less harmful effects when they encounter a phobia. With these two treatments maintained over time, the social anxiety should lessen to the point of normalcy. There is no cure for social phobia. However, they can become desensitized to the point where they know that they are okay. They will be able to fight their brain. They will be able to use the tactics that they learned in behavioral therapy to truly understand that nothing bad will happen to them and fight the irrational section of their phobia. The treatment of situational exposure therapy and lorazepam will have a significant impact on the patient's social anxiety if maintained for a long period of time. The patient will only get in what they put in to their therapy. They also must take their medication in order for their medication to work. This means that the patient must first want to get better for the treatment to really work.